Well, now to COVID, always with us. Today marks the 2-year anniversary of the first COVID-19 case in the United States on January 21st, 2020. A Washington man became the country's first positive infection, marking the beginning of the coronavirus pandemic on U.S. soil. And since then, the CDC has confirmed that more than 859,000 Americans have died. Think of what your reaction would have been at the beginning of this if somebody told you that 850,000 Americans had died from COVID. That's the highest total for any country on the globe. So let's take a look back on that life-altering moment.
Tonight, the first confirmed U.S. case of that mysterious virus tracked here to Washington State. A man in his 30s diagnosed 5 days after returning home to Seattle from Wuhan, China.
Our number one priority is to complete the identification of all the patient's contacts, reach out to the contacts, and monitor their health.
Health officials report the patient did not visit that Wuhan fish and meat market, ground zero for the outbreak, where today teams were busy disinfecting the streets.
I think the risk to American citizens now is low. Part of the reason that the patient was so rapidly identified and treated appropriately is because he himself was educated and recognized the risk.
And that was then, this is now, and joining us now for more is ABC News' Kaylee Hartung, who has been on the ground for the majority of this pandemic in so many places. Thanks for being with us, Kaylee.
Thanks, Terry.
So we've got some breaking news, I guess, coming into our newsroom right now, I'm told, regarding a possible reversal in the mandate that federal workers must be vaccinated. So what can you tell us about that?
Yeah, Terry, we're just learning that a federal judge in the Southern District of Texas has issued a nationwide injunction barring the federal government from enforcing President Biden's vaccine mandate that requires federal workers to get vaccinated unless they can prove a medical exemption or religious exemption, or else risk getting terminated from their jobs. Now, it was back in September that President Biden first announced this mandate. It went into effect in November. About 3.5 million federal workers falling under it today. The White House Press Secretary Jen Psaki saying that 98% of federal workers have been vaccinated by now. But now this federal judge, who was appointed by President Trump, he is saying that this is a bridge too far. He wrote that at issue was whether the president can, with the stroke of a pen and without the input of Congress, require millions of federal employees to undergo a medical procedure as a condition of their employment. And he added that under the current state of the law, as just recently expressed by the Supreme Court, this is a bridge too far. So, Terry, the Justice Department said it would appeal this ruling. But again, keep in mind, 98% of federal workers are already vaccinated at this point.
It is the principle of the thing, I suppose, and we'll see how that case goes. But I want to come back to your reporting, which has really been extraordinary and helpful for me and so many during the course of this pandemic. You've done so many stories, including the first community spread, the first death in the United States. You know, and I was thinking, just as I was reading that number, 859,000, there was so much we didn't know at the outset. So what was it like for you being on the ground at the outset, and what have you learned since then? How do you approach life in this pandemic and life with coronavirus as probably an endemic situation?
Yeah, Terry, listening to that report from Arcana Whitworth as she covered the first confirmed case 2 years ago, I had chills listening to it because it really brought me back to when I got the phone call to go to Sacramento for that first case of community spread. And to be honest, I got on that airplane with nothing more than the hand sanitizer in my purse. Wearing masks, personal protective equipment, PPE, as we so casually refer to it now, was such a foreign concept to any of us. And for that first case of community spread in Sacramento, that was when really big questions started to get asked, because this was someone who had not traveled internationally, had not been to Wuhan like the gentleman who was that first confirmed case. He'd been to Wuhan. It made sense for us to be able to connect those dots. But when all of a sudden you find yourself in a community where you can't trace back where that person could have contracted the virus, she didn't believe she'd been in contact with anyone who'd had it, but now we understand that virus was spreading among us undetected for so much longer than we realized. And what really turned the page for me was when I returned home after then covering that first outbreak of the virus in Seattle, that nursing home, Life Care Center of Kirkland. More than 46 people related to that nursing home ended up dying from COVID. But once I got back home to Los Angeles, I contracted it myself. And what I didn't realize was the fear that people had for me in that moment. I think my family members were so much more afraid for me than I was for myself in that moment. But the reality is, in that moment in time, we just didn't know. We didn't understand how transmissible this virus was. We didn't understand how people were contracting it. We've learned an incredible amount of information, and we're still learning as we see this surge of Omicron now taking hold across so much of the country.
You know, and your colleagues too, Kaylee, I got to tell you, when you contracted COVID, we were all, because exactly as you say, we didn't know. It was a mystery. Still is to some extent why some people get it so badly and others don't. We now have vaccinations. Those of us who are vaccinated are, you know, more thoroughly protected. But it was scary. I guess I'll ask, were you scared?
I wasn't as scared as maybe I should have been. You know, I think when we hear that number, as you've said it, 859,000 Americans have died from this virus. It's so hard still 2 years later to wrap your mind around. I think at the time, because I didn't feel as if my life were in danger physically, the symptoms I was feeling, I think that's why it was important for me to go public with my story, to share my experience, that for me, it was like the worst flu I'd ever had. It knocked me out for a couple of days because at that point in time, when I was sick, the second week of March 2020, there was so much concern for how deadly the virus could be. Of course, we've learned it could be, but I felt a responsibility to share my experience with people to say, you can contract this virus and you can be okay. I think there have been times through this pandemic where having that knowledge has maybe done more harm than good because we've seen people act irresponsibly, but it still stands that I was glad to be able to share my experience in that moment just to help us all understand a virus better that we still, as you said, have so many questions about.
Absolutely, and you succeeded. I do think that the numbers that were then developed, that the fatality rate and the serious hospitalization and sickness rate was pretty small. We now understand that statistically you helped us understand it humanly, I guess, and so much else. Kaylee Hartung, on this 2-year anniversary of the first COVID case in America, thanks for being with us.
Thanks, Jerry.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.